My name is Gillian. I'm 49 years old, and I am the client relation and patient advocate specialist for a local medical office. And I first met Michael about 15 years ago when I was experiencing extreme back pain. It was just so intense that I would have pain shooting up my back and down my legs to where it would send me crashing to the floor in agony. And the only thing that could take care of it at that time was pain meds and muscle relaxants. So I did what any person would do. I went to the doctor, who sent me for tests and sent me to a specialist who sent me for more tests, only for them to tell me that I had a bulging disc. And the bulging disc was a result because I had a weak back, and likely I would require surgery. So the thought of surgery sort of terrified me. So I thought, well, if I have a weak back, how do you make it stronger but to go to the gym and start exercising? So I knew enough that if I was going to do that, I needed to hire a personal trainer. So I hired one that was a kinesiologist, who at that time didn't want to do a whole lot with me until I had spoken to a chiropractor. Now, it's really important for you to know that at the time, I had a great fear of chiropractors. I thought they were all quacks and that they caused more problems than they actually solved. So I reluctantly went, and I remember walking into Dr. Michael Rodney's office for the first time. I introduced myself, told him what was going on and why I was there. And he said, well, I'm not going to give you an opinion of anything yet until I assess you. So he did. He had me do some exercises for him, and he did that. And he told me that I had scoliosis, which I knew I had suffered with since a gym accident in high school. And he told me I had a bulging disc. But he told me two things that really surprised me. One, that I had scoliosis in my lower spine, and that was certainly aggravating and may have caused the bulging disc in my lower back. So that surprised me because none of my other doctors had told me that. But secondly, he told me that he could help me, which didn't surprise me. But he told me that we weren't going to do a session that day. He wanted me to go home, think about what we had discussed, and come back with sort of an open mind. So that sort of surprised me. I wasn't expecting that. So it made me stop and think that maybe this guy knows what he's doing, that he cares more about the person than just money. And so I did. I left the office, I thought about it, and a couple of days later, I went back and I made an appointment. Now, knowing that, in my mind anyways, that chiropractors cause more harm than anything, I was very scared to death that he was going to paralyze me or something after he manipulated my spine. But Michael, to his professionalism, explained exactly what he was going to do, what it was going to affect, how I was going to feel, what I was going to hear, and he went slow. And that I truly appreciated. Not too many doctors nowadays want to take the time to alleviate patients' fears. And as a result of that, at the end of the session, I was feeling much better. And he gave me some exercises, which sometimes I did and sometimes I didn't do. But I felt myself getting stronger and went back for more and more sessions, and I felt more and more alleviated, to where 15 years later, I've had no back surgery. My back is stronger. And more importantly, I made a wonderful friend. I can't say much more than Michael is the best. I am truly honored to know such a wonderful man. He's a wonderful father, a wonderful chiropractor, and he will do his darndest to alleviate your fears, your concerns, treat not only the issue that you're there for, but the whole person. That's what a chiropractor does. And Michael does it very well. So I urge you that if you were in pain and you have your fears, don't let that stop you. Make an appointment to see Dr. Michael, and he will take care of you.